Hello everyone. So after a long back time, I am writing a letter. So yeah, we will see today. We will see a letter. Letter for Dallas Walter letter. We will be seeing today. Okay. So as soon as you received your letter, first thing is you have to see the writing task. Okay. In this writing task, using the information provided in the case note, write a letter of referral to renal clinical nurse specialist at Bunbury Community Health Center for ongoing community care of the patient. So I will be underlining only the important things which we needed to write in the letter. So you can differentiate which is important and which is not important while making the 2 minutes of preparation. Okay, that 5 minutes of preparation, sorry. So the name of the person was not given. So it is a renal clinical nurse specialist. So we will be writing faithfully in the final. Finally, we will be writing yours faithfully. If they are giving a Dr. Sebastian or nurse Linda, like that, if they are giving the name, you have to write yours sincerely. So as here they have given only the renal clinical nurse specialist, only the post which they are doing. So we have to write yours faithfully. This is a minute thing that you have to note in each and every letter. Okay. So if you are making mistake in all these kind of things, the marks will be go down. Okay. Then after seeing the writing task, as soon as you have to come to the front part of the letter. So today we are seeing Dallas Walter letter. Okay, this is the notes. Mr. Dallas Walter is a patient on renal ward where you are a charge nurse. We are a charge nurse, so we are registered nurse. Okay. So age 51. Age of the patient has been given. The date of birth was not given, so we can mention it as 51 age. Marital status, married with 2 adult children. Oh, he is married. That is not regional. Regional and cultural background is Uniting Church and Aboriginal background. That is not needed. Admission days. Yeah, this is important. 16 June 2011. Hospital name was not important, and discharge date is also important because we will be writing hospital admission date in letter, and we will also be discharge date also we will be mentioning in our letter. So it is important. So age is important, charge nurse important, Dallas Walter is important. So diagnosis: insertion of continuous ambulatory peritoneal dialysis CAPD catheter for CRF. Okay, for insertion of this catheter he had been admitted. Okay, for the hospital. Okay, so this is the so in introduction paragraph we will be writing all these detail. Introduction paragraph. So family and psychosocial history. So this is a social history. Okay, he is currently on disability support pension for schizophrenia. That is important because we have to mention in social paragraph. Mental status relatively stable with mild chronic delusion. Mild chronic delusion. Yeah, that is also important because sometimes we will include this in past medical history we will include. So mental status is currently relatively stable and with chronic delusions he is having. Alien are spying on me 24/7. Okay, that is an objective data, means subjective data, no need. Supportive wife is carer and has mild intellectual disability. Okay, this is important because carer is wife and she is having mild intellectual disability. That is an important point because for this kind of patient carer is important. If carer is having some disabilities, that also we need to mention. Okay, lives in demountable home in Bunbury Caravan Park. This is also important. We have to mention in social background. Patient loves fishing and some football legal. Football. This is football league. That is not necessary for a renal clinical health specialist nurse. If it is a social worker, we can community health nurse or social workers, we can mention this is a renal specialist work, not needed. Next thing. So what is next thing means? Yeah, current medical history. Okay. No, medical history, not current medical history. He is having mild chronic renal failure for 4 years. Recently worsened. Okay, because of recently worsened reason, that is the reason for dialysis catheter insertion. So this is important. Type 2 diabetes, stable compliance with oral medication. Okay. Type 2 diabetes also important and it is stable with oral medication. He is also compliant with oral medication. Currently, this is current situation. These two things are current situation. So we have to diabetic and renal history. We have to update for that clinical nurse, renal clinical nurse. So we are mentioning removal of cataract eye lens, removal cataract eye, left eye and insertion of intraocular lens. This is a past thing. We don't need a finished things. Currently not affecting any other thing. So we are not including. Quiet smoking and drinking 4 years ago. Past things not needed. Previous heavy for continuous 4 years not needed. Previously he is drinking. Currently he is not taking. That to 4 years ago. Not needed. Medication to be forwarded by medical officer. Okay, no need. Management and progress during hospitalization. What they have done in hospital. Uneventful procedure. Catheter inserted successfully. Okay, catheter inserted successfully. Prolonged admission as patient and his wife slow to learn. Management of CAPD. Okay, that hospital admission had been prolonged because the patient and his wife slow to learn management of CAPD, because wife having slight intellectual disability and patient is having a psychiatric patient. So okay, that is it is an important reason for prolonged admission. So we are because why we are writing this point means we are reinforcing the clinical nurse about the patient and his carer situation. We are reinforcing, making the clinical specialist nurse to know about the background of the patient and his attendant. Okay. Hyperkalemia and needed cardiac monitoring for 2 times in 7 days. Okay. Previously he was hyperkalemic, but potassium level is 4. Now it is normal. Okay, this is the normal range. Now it is normal. Regarding acute psychosis, changes with patients. Okay, this is general not needed. This is a past history. Previously he is hyperkalemic and cardiac monitoring had been done. Now the patient is normal. Now he is normokalemic. Mental health status also become normal. So that all these things is was not needed. Okay, not needed. Then this is the discharge plan. This is the expansion of purpose paragraph. This is the expansion of purpose paragraph. This is previous medical history. So we are writing discharge plan. So educate for patient and wife regarding CAPD and CRF. Okay, monitor for catheter site infection and signs of peritonitis. That is important. Important to educate and minimize potassium in diet. Okay, so they are mentioning potassium, minimizing the potassium rich diet. So we can insert this previous history, because if it is vaguely writing minimizing the reason for potassium rich diet, it is not good. So we have to connect with this. Previously he is hyperkalemic, now he is normal. Even though we have to educate him regarding minimizing the importance of potassium rich diet, like that we can connect so that it will be meaningful, because patient is having the chronic renal failure patient. So minimizing potassium rich diet is important. Sign observe for the signs and symptoms of psychosis if necessary, and refer if necessary. Okay, if necessary, get community aboriginal health worker to reinforce. Aboriginal means capital A should come. Health workers to reinforce CAPD and CRF education. This is also important. This is if necessary. We can connect this first thing and this thing to while writing. I will show. Okay, this is the thing we are going to write in this letter. Okay, this is accordingly, it is a simple letter. If you practice so much of letter, you can able to connect easily while writing the letters using connectors. I will show you how to connect a letter with connectors. Okay, so we will start. So, starting we will be writing the date, the admission, no, discharge date we will be starting as admission. So, first date, okay. 22 June 2001. Okay. To whom you are writing? The renal clinical nurse specialist. From we are taking all these points from writing task. The renal clinical nurse specialist at the not the Banbury Community Health Center. That's it. So next thing we are writing, dear sir or madam. No comma, no full stop. As it is we are writing regarding. So 2 dots. Mr. Dallas Walters, comma, aged 51, as they have given aged 51. So next paragraph is this is an introduction paragraph, so it should contain what to do, why to do. For what we are writing, to give a ongoing community care for the patient. Okay, why to do? Because he underwent an insertion of continuous CAPD catheter. Okay, this every introduction paragraph should cover these 2 points, what to do and why to do. Here we are, I am writing this letter to refer Mr. Dallas Walter, who requires ongoing community care and monitoring from your service. Not at your service, from your service. Because at your service means if you are referring to community, to her clinic, to a doctor's clinic or to specialist clinic, that is a place we are referring the patient. So we are not referring the patient, we are referring a patient to a person. So person has to come and meet the patient. So from your service is exact thing. Why to do? Because he underwent an underwent an insertion of a continuous, we should not use short forms, continuous ambulatory peritoneal dialysis, catheter for chronic renal failure. This is the thing. And he is having any discharge history or anything like this, we can include. He is discharged today. So introduction paragraph had been completed. So we will be expanding this introduction paragraph with the current thing what they have done in the hospital. So we will be included this point. Okay, we will be including these 2 points, this 2 paragraph we will be combining together. So can we see? Yeah. Mr. Walter. From here you have to write second name. Okay. Is it visible? Yes. Mr. Walter. Yeah. Was past tense, was admitted to our facility on 16 June 2011. They have mentioned they have mentioned as an admission date. Following a recently worsened chronic renal failure. This is the reason. Full stop. For which a catheter was inserted successfully. So one thing had been completed. Okay, so this thing was completed. Recent worsen, we have combined all these things. The recent worsen, this thing had been completed. Then prolonged hospital admission and patient wife was slow to learn. This point we can include. Okay, how we will include? We will use connectors. However, he had a prolonged prolonged hospitalization as he and his wife had to learn the management of CPD. Okay. Then we will write that hyperkalemic point. He had not has, he had hyperkalemia, which is currently normal. So we will be connecting. Therefore, it is important to educate him on minimizing the potassium rich diet to prevent hyperkalemia. That's it. Simple. We have connected all the things. Okay. So we have in that current thing what they have done, we have included. What is the reason for hospitalization we have included, and previous history of hyperkalemia we have included. Okay. Then what is the next thing? So next thing is we will write previous medical history. Mr. Walter has had mild chronic renal failure for 4 years. And he has diabetic also. He has type 2 diabetes, which is stable with oral medications. Even though his mental status is stable, he has mild he has mild chronic delusion. He has mild chronic chronic delusion. So previous history, renal failure we have included, type 2 diabetes we have included, which is stable also we have included. Then about chronic delusion we have included, so that we can connect for this signs and symptoms. Okay, then that point also we can connect. Therefore, kindly observe for the signs and symptoms of psychosis and refer if necessary. Okay, this past medical history also we have been completed. So what is the next? Social history. In social history, see, all these things we have completed. 4 years, diabetes, prolonged admission, hyperkalemia also we have completed. Minimizing, this too is pending. Minimizing psychosis we have mentioned. So final paragraph we will be connecting, and so all these things we have completed. And yes, in social paragraph we will be writing all these things. This is also we have completed in social paragraph, and discharge thing is pending. Okay, yeah, so we will write social paragraph. Mr. Walter lives with his wife in demountable home in Bunbury Caravan Park. Okay. Although his wife has mild intellectual disability, She is very supportive. So third point is that pension. In addition, so if you are using although, one comma should be there. This is a complete point. Okay, one comma should be come in between. So simply you have, if you are using although, even though, two parts should be there in one sentence. Okay. In addition, yeah, he receives a disability support pension for schizophrenia. Okay, full stop. Next is discharge. One line you can. So discharge plan, it would be pending all the points we will be covered. It would be appreciated if you could arrange a community aboriginal social worker to give education to him and his wife regarding CRF and the importance of dialysis or CAPD, you can write. Okay, so this thing we have completed. Yeah, so off note, kind, this is important. Kindly, it will not happen, but kindly monitor for catheter infection and signs of peritonitis. Okay, then if you have any queries, please do not hesitate to contact me. This is a common line we are using. Then yours faithfully, as the name was not given, yours faithfully. So we are registered nurse. One line we have. This stop, full stop should not become registered nurse. So that's it. This is the letter. Okay, so this is a simple letter. Don't think how continuously without looking or without having a reference, how I can write a letter like that. Don't think. If you are practicing if you are practicing more than 15 letters, automatically the 16th letter will be fluent for enough to connect with all the connectors. So be strong in the grammars and be know with all the connectors how you have to be used that connectors. And the third thing is you have to know the structure of a letter. So first we have to start with date, to address, respected sir or madam, like that. Then introduction paragraph, purpose paragraph. Then second thing is expansion of the purpose paragraphs. Third thing is current, past or past medical history, social history, to whom, how we have to write. All the things you have to be thorough with that. So if you are writing, as I have been told, if you are writing continuous letters, you will be thorough with all these kinds of things. So scoring a 350 plus marks in a letter is a quite good thing. So you have to practice more letters. That's it. Thank you. We will see in another good letter. Thank you.